The abstinence-only program that was taught at my high school and at most schools in this country was not adequate enough to prevent many teens from getting pregnant or getting sexually transmitted diseases. Comprehensive sexual education classes can be much more effective. Today I'm going to talk to you about why it's important to teach high school teens about abstinence, contraceptives, and sexually transmitted infections. The teaching method that is common between both programs is abstinence. I'm sure most of you know that abstinence is refraining from all sexual contact. Abstinence is good in theory, since abstinence is the only 100% effective way to prevent pregnancy or infections. There's no room for errors like a condom breaking if you just aren't doing it. But it has been shown that the only way that abstinence has been proven to work is when it is taught in the religious aspect. The problem then lies that it has been declared unconstitutional to teach religion in public schools. Because of this, abstinence is not entirely practical. It's like waving a big piece of chocolate cake in front of someone who is diabetic. The diabetic knows that it isn't good for them because it could have serious consequences, but telling them they can't have it just makes them want it more. If you tell a teenager they can't have sexual contact without giving them a reason, they're going to be focused on what's so good about it that they can't have it. Practically, abstinence just doesn't work. A study done on a program called Postponing Sexual Involvement actually found that students enrolled in PSI were more likely to become pregnant or cause a pregnancy. The best way to counteract this problem is to give teens all of their other options. For example, teaching them about contraceptives would be another option. For girls, that would be birth control. The only issue with that is how difficult it can be for teen girls to access. Most girls would not be comfortable asking their parents for birth control, even though it is a good option for preventing pregnancy. A good solution to that issue is to establish free health clinics in schools. I'm not saying that they should just be for birth control, but for a range of different diseases. They would also be helpful to the needier families in the district by providing health care to their children at no cost. For boys, it would be condoms. Teen boys need to be taught proper use of condoms since they are the most accessible form of birth control. If condoms aren't used properly, they can break. I've heard boys use nonsense logic such as 2 condoms are better than 1, when in reality that makes the condom more vulnerable to breaking. Mistakes like these leave both parties vulnerable to pregnancy and sexually transmitted infections. The last reason to teach comprehensive sexual education is to prevent sexually transmitted infections. Sexually transmitted infections are the most serious and long-lasting effect from unprotected intercourse. Abstinence-only programs leave teens vulnerable to STIs because they avoid the subject completely. You can't prevent teens from putting themselves at risk if they aren't taught the dangers in the first place. There are 10,000 new cases of STIs in people under 22 every year. Many of them will be left with that reminder for the rest of their lives. HIV is one STI that cannot be cured. The symptoms can be treated, but eventually it will turn into full-blown AIDS, which is deadly because it compromises your immune system. The majority of teens know what HIV is, but they believe that they couldn't ever be at risk. 1 in 4 teens ages 15 to 17 who report being sexually active say that they have never been tested for HIV or any other sexually transmitted infection. Comprehensive sexual education classes teach teens about STIs. Teens need a rude awakening when it comes to STIs, like pictures and details of the side effects. My husband's high school had a more comprehensive sexual education program. He was shown pictures of herpes outbreaks and other common side effects of STIs. He says that it encouraged him to use a condom every time, and he started getting tested for STIs on a regular basis. There have been many studies done on comprehensive sexual education courses. The main concern about introducing these ideas or other options to teens has been that it may encourage them to become sexually active at a younger age or increase the frequency and number of partners. The studies have actually shown the opposite. Teens who were taught through a comprehensive program became sexually active either at the same time or later than a teen that was taught with an abstinence-only program. Also, teens who are taught with a comprehensive program have sexual intercourse less frequently and with fewer partners than teens who learn through abstinence-only programs. If we want to protect our kids from becoming parents or developing a serious disease before they graduate high school, we need to take a stand. I don't want my kids to live their teenage years the way I did. I had a baby and a job to worry about when I should have been worried about school, work, and prom dates. The only way to keep our kids safe is to teach them about all of the options: abstinence, contraceptives, and sexually transmitted infections.